Hello everybody, my name is Roberta Basile. I'm Dr. Vet from Brazil, and I would like to thank very much Professor Camilo Rivera for this invitation to do this presentation for you about infrared thermography. My background started in engineering. I am civil engineering, graduated in Brazil, and I have master in aeronautics in 2003, and then I was graduated in veterinary medicine in 2012, and after I had my PhD degree in the same university, and after I had my specialization in pain neuroscience at UFSCar, also in Brazil. I started my career in Araraquara, Brazil. It's a beautiful city, as you can see. I invite you to visit the city, and now I'm living in Germany, in Stamberg. It's also a beautiful, beautiful city. Different, but beautiful. So let's start. What is thermography? What is thermography? Basically, thermography is an infrared image. An infrared image that can show us the heat infrared waves emitted by bodies, as live bodies, other or non-live bodies, is captured by lens with an infrared sensor, and this image converts the temperature into colored pixels. It's important to know the three ways that bodies can emit it and conduct their heat. The three ways were convection, conduction, and radiation. And the parcel of radiation emitted from the bodies is received by the infrared sensor. Here you can see an example of a thermographic camera or infrared camera that has an infrared sensor here in their lens. This application, this tool, was designed in the Second War by military forces as a tool to recognize, to search enemies. So was a tool used by military aircrafts. Now, fortunately, we have this tool mainly for medical uses. It's very interesting in medical uses, in humans and in animals. And the output of these cameras are those images, infrared images. And I can explain to you that all of the pixels of those images have a temperature, a specific temperature that is converted by color. So we have this scale of color and this scale of this scale of colors and this scale of temperatures, and we have the presentation of the image of the pixels temperatures. I will present to you many touristic points in Brazil if you can visit these beautiful places. Here we have Cristo Redentor in the state of Rio de Janeiro. It's a very beautiful place. So when can we use this tool of thermography? How can we apply this tool in our clinical routine? So, if we receive a patient, obviously in the first meet we will perform the anamnesis, and then if we have an infrared camera, we can perform the infrared exam right after the anamnesis. After that, we can conduct normally our physical exam with palpations and tests, all we can have to do, and observe the images with our results of physical exams to conduct a better possible diagnosis, the list of possible diagnoses, and conduct complementary exams. I ever say that the infrared is like a stethoscope of an orthopedist, because this tool can provide more information than the palpation or inspection, visual inspection, and can zoom information to orient the professional to conduct complementary exams. After, when we have the final diagnostics, we can conduct the treatment, the proper treatment, and we can follow up the treatment with infrared exams to see if the treatment is conducting good, is going well, is going better, other worse, and if we have to make some treatment modifications. So it's a valuable tool to do this follow-up during the treatment. I will show you. So, which kind of information we can have from these images? Firstly, and mainly, we can have information about increased blood perfusion and about decreased blood perfusion. And obviously, we can conclude or be oriented about some pathologies that are doing in that patient that causes increased or decreased blood perfusion. So in case of increased blood perfusion, it's very clear to verify locations of inflammation like dermatitis, tendonitis, desmitis, myositis, neoplasias, or other benign modules, infections, or acute osteoarthritis. So, as you can see in this image, it's possible to see a horse, and the fat lock of this horse is obviously with increased blood perfusion and obviously in the medial part of the fat lock. So we can have some guide to conduct the other exams. And about decreased blood perfusion, we can have information about ischemia, some neoplasias, some nodules. Necrosis is very important for necrosis, for thrombosis, for neuropathies, and for chronic affections like chronic osteoarthritis. So here you can see other horse with decreased blood perfusion in the left forelimb. So we can have some information and we can have some guide to inspect better what is happening in that limb. Here we have other beautiful touristic point in Brazil. It's called Fernando de Noronha. It's an island in Pernambuco. Very, very, very beautiful. So what about diagnosis? What kind of images and what kind of affections we can have information from thermography? Here we have a case of a dog with neoplasia. So in the thermography is very clear to know the extension of the inflammation, of the alteration, and you have the ultrasound exam in the right side that can show us the aspect of this nodule. So in case of nodules, the thermography is very interesting to guide the extension of the alteration, of the tissue alteration. Here we have other example in a dog, the female, of neoplasia, mammary neoplasia, and it's interesting to see that all the lymph nodes, the inguinal lymph nodes, are also in the process of the neoplasia. So it's very, very interesting to guide us about the importance and about the structures that is in the process, active in the process. Structures that are, sorry about my English, active in the process. Here we have another case of neoplasia, but it's different. It's a decreased perfusion neoplasia. It's interesting. And you know, you can see in the right side the aspect of the nodule, and in the left side you can see the extension of the nodule. Other interesting use of thermography is to detect osteoarthritis, mainly in the case of the osteoarthritis of low degree, degree 1 or 2, that we don't have yet alterations in radiographics, and we can see here in this dog that the right shoulder is warmer, it has blood increase compared to the left shoulder, and after we perform the ultrasound, and we can see the important alteration in joint capsule and cartilage, and in the insertion of the tendon of muscle biceps. Here in a horse, is obvious by the exam of the X-ray that he has osteoarthritis in a severe degree, in this case degree 4, But we can see also in the thermography the extension of the inflammation. And we can see that this horse has, it's possible that he has a severe pain because of this osteoarthritis. Here I present to you also some publications, some scientific articles that can show the importance and the use of thermography in experimental medicine. This group evaluated the treatment of working dogs that have osteoarthritis and monitor the treatment with thermography. It's a very interesting article. Back pain. Thermography is very interesting to help in the diagnosis of back pain. Now you can see some alterations in the back of a dog and of a horse. And the thermography interesting because we can see the extension of the inflammation, and is easier to identify the trigger points of these patients. Here, other two horses with different in severity of the back pain. So it's really easy to see how severe is the process of inflammation when we can have a thermography. Another study, very interesting, changes in body surface temperature associated with high-speed treadmill exercise in beagle dogs measured by infrared thermography. Here, the researchers concluded that the thermography is interesting to monitor the increase of the perfusion in the muscles that were trained by treadmill. In sacroiliac dysfunction is very interesting because it's a difficult pathology to diagnose in horses, and the thermography can show us about the perfusion. This mare had a rotation in the pelvic bone that compress the nerve roots of the right side. And you can see in this image the decreased perfusion in the right side of the limb, the pelvic limb. And it's interesting to see that these muscles had hypertrophy also. Interesting also to identify myositis. Myositis is another affection that is difficult to diagnose in horses or dogs, and with thermography is very simple to see the alterations because the perfusion of the muscle changes, and we can see this very clear. Another study, interesting study, that compared the salivary cortisol and the eye temperature to verify modifications in stress during the competitions. It's very interesting. And they saw a correlation between the cortisol and the eye temperature. Tendonitis. obviously in horses we have many more cases of tendonitis, but when we have a tendonitis case in a dog, is really difficult to diagnose. And because in the mainly situations, we only have x-rays to perform in dogs. It's difficult to have a professional that can perform an ultrasound, musculoskeletal ultrasound in dogs. And the thermography can help us very much in these cases. Here you can see a dog with tendonitis in the right front limb, specifically in the bursa of biceps, tendon biceps, and is very easy to see with thermography the alteration. And in horses, that is more frequent to have tendonitis, is really simple to verify. As you can see in this image, it's very simple to see that we have alterations in the right front limb, and after, when we perform the ultrasound, it's clear to see the alteration. Here we have another study of the use of thermography in comportamental cases. Here, the researchers performed thermography to evaluate and to identify aggressive dogs. It's very interesting. In this study, they performed the thermography of the face of the dogs, and they concluded that aggressive dogs have more increased temperature in their faces. It's very interesting. Septic osteoarthritis. So we can see this is a foal that has septic osteoarthritis, and was very clear to see in the thermography the alteration. The alteration was in the all four fetlocks of this foal. Another study about physical conditioning, but now in horses, that shows that thermography is possible to monitor the training of thoroughbred race horses, evaluating the temperature of the muscles. This mites is very simple to see also in the thermography. Here you can see the alterations in the left front limb, and we can see the alterations, the increased temperature in the obliquous ligament. We can see the path of the obliquous ligament. It's very interesting. Another study, association between the area of the highest flank temperature and concentration of reproductive hormones during pregnancy or in polyclinic horses. Now you can see that it's possible to use thermography also to monitor the reproduction of mares. The cycle reproduction of mares is very interesting. Navicular syndrome is difficult to diagnose also, and here we can see in the thermography of the left, the dorsal thermography of the left front limb, the alteration, the increased temperature in the hoof, and when we performed the ultrasound, transcranial ultrasound, we saw that the bursas were augmented, and was desmitis of impar ligament. Another touristic point in Brazil, Chapada dos Veadeiros in Goiás, is really beautiful forest to visit. In the treatment follow-up, how we can see the thermography in the treatment follow-up. Saddle fitting is very interesting to use thermography as a tool to help us in the saddle fitting. So now you can see the profile of temperature distribution in the back of the horse and in the saddle, and we can perform these adjustments. To see the effect of some treatment that can cause confusion in some people, like chiropractic or acupuncture. I will show you some results. Here you can see a sequence of thermographies that is separated from 5 minutes only. Before, the first one in the left up is before the chiropractic adjustments, and the last one is 5 minutes after the end of the chiropractic adjustment. And you can see all the parasympathetic stimulation that this technique can perform in the patient, and you can show to people that are accompanying you in the treatment. It's very interesting. Acupuncture is another powerful way to treat our patients, but many people don't realize about the effects, the real effects. And here we can see the effects of vasodilatation and perfusion of only one point of acupuncture. You see, by Rui, only one point. They start and you will starting to see the perfusion. Is very, very fast. See the modification from the start of the treatment. It's very fast. It's good to show to everybody the effect of that technique. They start. Ozone therapy. Here we have a video that we filmed the effect of retal ozone, intraretal ozone therapy. And you can see the vasodilatation and perfusion also. I will show to you. They start. This video has 20 minutes, so I will move forward to be faster. They start. Now you can start to see the alteration with 15 minutes. Huh? 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 Beautiful, huh? I will put in the start again. See the difference. It's magic. Without thermography, you cannot show this. The use of taping. In this case, I was using taping for anti-inflammatory effect. And you can see the difference between the photos are 1 minute, only 1 minute. You can see in the legend of the photos, 1 minute, 89, 80, 10. And it is the same scale, huh? 0 to 15 degrees, the same scale, the same horse, 1 minute difference. And the combination of acupuncture and ozone therapy, all the increased blood perfusion of acupuncture, and after all the anti-inflammatory effect of paravertebral ozone therapy. See, please. So they start. I will move forward also because the video has 20 minutes. I'm doing ting points that are points in the coronary band of the hoof in horses. I'll move forward. Now I will start to put the points, acupuncture points. You can see it's possible to see the alteration in the perfusion. See? Here. 5 minutes after the introduction of the needles. 5 minutes. Only 5 minutes. And now you see the ozone therapy, the anti-inflammatory, instantaneously the anti-inflammatory effect of ozone therapy. I'm picking up the ozone. Now, see, 1 ml, 1 milliliter of ozone. I'll pick up more, but you can see the temperature is decreasing. You can see? Oh, okay, I'm going back. Another point. See. Oh, see. It's instantaneously. Huh? The horse is green again. I will go back for you to see the difference. Before and after. So, another beautiful place, Pantanal. bonito. It's absolutely beautiful place in Mato Grosso do Sul in Brazil. I recommend you to go there. Advantages. So, thermography can guide us to pathologically active regions, can facilitate the identification of pain targets, can guide us about the extension and severity of the injury, allows the identification of perfusion deficits, and facilitates the follow-up of treatment progress. It's a fast, really fast procedure, non-invasive and contactless. This is very good to can evaluate a patient without contact, and but requires specific procedures, even to image acquisition and to analysis of these images. So, thermography can be performed after a treatment, a procedure that we can know how we are doing. I recommend you two researches, two articles to understand about thermography and the procedures to conduct an examination. This is guideline for veterinary thermography, is very interesting, and this is one guide that I prepared, but is in Portuguese, but today it's possible to conduct the translation. It's very simple to do in Google Translator, so the practical guide in equine thermography examination. I want to thank you very much for your attention, and now I can thank the possibility to stay here and to talk to you about thermography. Thank you very much and have a nice Congress. Bye bye.